1 in 9 women is said to develop breast cancer. In fact, among all cancers affecting women, breast cancer has the highest incidence. It's not just a concern for women, men can be affected too. Recently in the news, Brother Korn from Bubblegum Brothers, at the age of 67, announced on his social media that he, as a man, had developed breast cancer. But don't worry. Breast cancer often develops near the surface of the body compared to other cancers. It can sometimes be detected through self-checks. When breast cancer is found at stage 4, the 5-year survival rate is said to be 33.8%. However, if it is detected early at stage 1, the 5-year survival rate is said to be 97.1%. By detecting it early and undergoing surgery or hormone therapy, it is one of the cancers that can be treated. So this time, I'll talk about the early symptoms of breast cancer that you would regret missing, the methods for self-checking, and finally, the screening recommended by the Ministry of Health, Labor, and Welfare. I will introduce a method that has reduced the mortality rate from breast cancer by as much as 32%. And at the end of the video, I'll also introduce dietary and exercise methods that can help lower your risk and prevent breast cancer, so please look forward to it. Here at YouTube Medical University, we will continue to share easy to understand and accurate preventive medicine information that you can use starting today, so I would be happy if you subscribe to the channel so you don't miss any new videos. Now let's begin the first lesson. I'll cover the early breast cancer symptoms that are risky to ignore. The first of 3 dangerous early symptoms is a lump in the breast. Why? The reason I explained this first is because 90% of people who are diagnosed with breast cancer after a self-examination of their breasts found a lump, making it the most common symptom. However, it's important to note that just because you feel a lump doesn't necessarily mean it's breast cancer. According to the data, for people under 60 who have a lump in their breast, among those who went to see a doctor, less than 10% were actually diagnosed with breast cancer. So having a lump in your breast, thinking like that can make you feel hopeless and want to give up, assuming it's already breast cancer. Instead of thinking that way, remember that the probability of it being breast cancer is not very high. However, the most common sign that leads to the discovery of breast cancer is a lump in the breast. So please consult your regular doctor, or if there is a breast clinic or breast surgery specialist nearby, try to consult with them. The second of the 3 early symptoms of breast cancer that are dangerous if overlooked is abnormal nipple discharge. The kanji may look complicated, but simply put, it's about the nipple area of the breast. If you notice a red liquid that looks like blood or a yellowish fluid, what we call exudate, coming from the nipple, that's when you should be concerned. Of course, this symptom can also occur with conditions other than breast cancer, such as mastitis. When should you be more concerned about breast cancer? You should be careful if it happens on only one side. It's hard to notice if the amount is small, so as a way to check, look for stains on the inside of your bra when you take it off, or check your clothes for stains when you take off your pajamas in the morning. By making it a daily habit to check, you may detect early symptoms of breast cancer, which can be dangerous if ignored. There are 3. The third one is a dimple in the breast. Please take a look at this image. It's a close-up, so it might be hard to see, but can you notice the slight dimple? Even if there is a dimple in the breast, many people don't notice it unless they look carefully. The easiest way to check is to compare both sides in front of a mirror. Breast cancer is more likely to develop on one side rather than both sides at once. Please compare both sides and check if there are any changes in shape. I think it's good to get into the habit of checking once a month. For example, you can compare both sides when removing body hair or when applying body cream. If you make it a part of your daily routine like that, it might be beneficial in the future. It's dangerous if you miss it. Here's the 4th of the 5 early symptoms of breast cancer: irregular menstruation. Actually, some types of breast cancer in women. New research is increasingly revealing that it's related to hormones. Because of these effects, women who still have their periods may experience unusually long gaps between periods, or their periods may come earlier than a month apart. When such changes occur, there is also a possibility of breast cancer. Of course, irregular menstruation can also be caused by ovarian problems or stress, or by undernutrition, meaning not getting enough nutrients. Irregular periods can happen for many reasons. Please keep in mind that having these symptoms does not necessarily mean you have breast cancer. 5 early symptoms of breast cancer that are dangerous to overlook. The 5th one is swelling under the armpit. In addition to arteries and veins, our bodies actually have lymph flowing through them. Lymph is responsible for removing waste from the body and supporting the immune system. There are pathways throughout the body where cells that fight bacteria flow, and these are called lymphatic vessels. Along these pathways, there are checkpoints called lymph nodes located in various parts of the body. One of these is the axillary lymph node, which is found under our arms. It's actually a small lump, less than a centimeter in size, but normally it's not swollen, so even if you try to feel for it, you usually can't notice it. However, if you develop breast cancer, cancer cells can travel through the lymph fluid, triggering an immune response, which can cause the lymph nodes under the arm to swell. Specifically, this swelling occurs in the area of the armpit closer to the chest. Please try to lift up the area where the pectoral muscle is, as if you are massaging it upward like this. When you check like this and feel something hard and lumpy, or you clearly feel a hard lump, it could be that breast cancer has metastasized to the lymph nodes. There is a possibility of that, so I think it's a good idea to make it a habit to check your armpits as well when you check your breasts every day. As for other early symptoms of breast cancer, some videos mention pain, but it's actually said that the lack of pain is a characteristic of breast cancer. When there is pain in the breast, we actually suspect other diseases like mastitis. Among people who visited the hospital complaining of breast pain, less than 1% were diagnosed with breast cancer. So please don't misunderstand and think, I'm safe because I don't have any pain. So how can we detect these early symptoms at an early stage? Let me introduce some self-check methods. One method of self-check that started being talked about in the UK in the 1900s is called breast awareness, which means you should pay attention to any changes in your breasts. If you can notice even small changes in your breasts through daily self-checks, breast cancer can be detected and treated early, which lowers the mortality rate. That's why this is getting a lot of attention. As a recommended method, you should check your breasts at least once a month. That being said, it's hard to make time to deliberately check your breasts when you're busy every day. For example, after taking a bath, when you put cream on your face, make it a habit to apply body cream once a month, and at that time, try to touch your breasts. When touching, don't pinch or squeeze hard, but rather gently stroke your entire breast in a circular motion, keeping your hand in contact with your breast the whole time. If you notice any lumps, a dimple-like indentation, any discharge from the nipple, or if the skin around the areola is irritated or raw, please check for any of these changes. To do this, try raising your arm, as it makes it easier to feel under your armpit and lifts the breast so you can check it more easily. Please give it a try. As for the timing of self-checks, for women, the breast tissue develops before menstruation, which can make it painful to touch or feel like there are lumps that can be mistaken for something else. So please make it a habit to do self-checks after your period ends. Now let's review the first lesson. The early symptoms of breast cancer that you shouldn't overlook and would regret missing include a lump in the breast, abnormal discharge from the nipple, a dimple-like indentation in the breast, irregular periods, and swelling of the lymph nodes under the armpit. I've introduced these kinds of characteristics. As a point of caution, the most common sign that leads to the discovery of breast cancer is a lump in the breast, which accounts for about 90%. But even with this lump in the breast, people often just think, oh, there's a lump. It is said that only about 10% of people who thought they had a lump actually had breast cancer, which means that, on the other hand, breast cancer often has no early symptoms. How can we detect it early in these cases? I'll cover that in the second half of the video, so watch until the end if you're interested. I'll also discuss people at higher risk for breast cancer. I'll clearly explain 4 characteristics of people who are at higher risk for breast cancer. Here are the 4 main risk factors for breast cancer. The first one is this. It's people who have been exposed to female hormones for a long period of time. That alone might not be very clear. Most women have female hormones, but depending on how you've lived your life, the period of exposure to female hormones can be almost twice as long for some people compared to others. There are 4 main characteristics. People who started menstruating early, those who have never had children or had their first child at an older age, those who have never breastfed a baby, or those who breastfed for only a short period of time. The period is quite short. This also applies to people who use female hormone medications. Why are these people at higher risk? It's because you're exposed to female hormones from the time you start menstruating until menopause. But during pregnancy and breastfeeding, your hormone balance changes, so your exposure to female hormones is reduced during those times. If you start menstruating too early, your exposure to female hormones is longer, and people who haven't experienced pregnancy or breastfeeding are also exposed to female hormones for a longer period. And it's also said that people who use low-dose birth control pills or take female hormones for menopause treatment have a slightly increased risk of breast cancer. However, the female hormone medications used in low-dose pills or for menopause are, in any case, many people use them because their periods are painful or the bleeding is too heavy. Some want to control the timing of their periods because they play sports. Others use them because menopausal symptoms like excessive sweating, headaches, numbness in the hands and feet, or feeling depressed are really tough to deal with. By using female hormone medications, their quality of life improves dramatically, and they're able to do things they couldn't do before. There are many such benefits. However, on the other hand, there is data showing that it does increase the risk of breast cancer to some extent. It's important to consult with your treating doctor, get a checkup before starting, and have regular examinations while undergoing hormone therapy. So make sure to understand this correctly and be appropriately cautious. Here's the second characteristic of people at high risk for breast cancer. People who are obese. What does being overweight have to do with breast cancer? I think many of you might be surprised by this. Actually, these fat cells in obesity play a major and important role in producing female hormones. After women reach menopause, the amount of female hormones drops sharply. So how are female hormones produced after that? Actually, inside the body, male hormones are converted into female hormones by the fat in the body. This means that after menopause, people who are obese and have a lot of fat tend to have higher levels of female hormones, which is why it is believed they are more likely to develop breast cancer. Here's the third characteristic of people at high risk for breast cancer: family history. I think this is well known. If you have a blood relative who has had breast cancer, there is data showing that your risk of breast cancer increases, so please be aware of this. High risk of breast cancer. Here's the fourth characteristic of people at high risk: age. Do you know at what age breast cancer is most common? While many types of cancer tend to increase after the age of 60, breast cancer starts to increase from your 40s, and it's said to peak in your 50s. If you know someone around you who has had breast cancer, please try to recall their age. Aren't there quite a few relatively young people as well? Now, let's review the second period. I introduced 4 characteristics of people who are at higher risk for breast cancer. The first is people who are exposed to female hormones for a long period of time, such as those who start menstruating early. People who have never been pregnant or who had their first childbirth at an older age. I mentioned people who have never breastfed, those who breastfed for a short period, and those who use female hormone medications. The second characteristic of people at high risk that I mentioned is being obese. Actually, it's believed that the reason is fat cells convert male hormones into female hormones. The third characteristic is having a family history, and the fourth is age. It starts to increase in your 40s and peaks in your 50s. One of the characteristics of this breast cancer is that it tends to occur at a relatively young age. So, based on this knowledge, how can people who are at particularly high risk detect it early? What should be done to detect cancer at an early stage, even when there are no initial symptoms? The Ministry of Health, Labor, and Welfare also recommends this for breast cancer. I will introduce in this third part a method that has reduced the mortality rate by as much as 32%. On YouTube and social media, both medical professionals and non-professionals share various medical information. At YouTube Medical University, we provide easy-to-understand information based on data from a doctor's perspective, so I would be happy if you could subscribe to the channel. Now, finally, let's move on to the third part. I will introduce methods to detect breast cancer early and reduce the mortality rate. At the end of this third part, I will also explain how you can lower your risk of breast cancer not only through screenings, but also by improving your diet and exercise habits. a method that can reduce the mortality rate from breast cancer by as much as 32%. What is it? To give you the answer right away, it's breast cancer screening. Some of you might be thinking, well, I already know about breast cancer screening, but have you actually had one? At what age should you start? How often should you get screened? In fact, in Japan, the rate of women getting cancer screenings like breast cancer and cervical cancer screenings is less than half compared to Western countries. This low rate is a characteristic of Japanese people. While many Western countries have rates of over 80%, Japan's rate is only 35%. The reality is that only 1 out of 3 people actually get screened. According to research by the US Preventive Services Task Force, women aged 50 to 59 who undergo breast cancer screening have a 14% lower risk. For people aged 60 to 69, in other words, those in their 60s, it was reported that the risk of breast cancer decreased by as much as 32%. There is similar data in Japan, and this breast cancer screening is actually called a population-based cancer screening. It is one of the cancer screenings recommended by the national government, especially by municipalities. Once you are over 40, you can have this breast cancer screening once every 2 years. What happens is, first, you'll have a brief interview that takes a few minutes to check if you have any symptoms or concerns, and then the doctor will examine you. The doctor will visually inspect and palpate your breasts to check for any changes in shape or color. Through palpation, they will also check for lumps or swollen lymph nodes. And finally, you'll undergo an imaging test called a mammogram, where your breast is compressed and an X-ray is taken. By taking such images, even if you have no symptoms, this kind of screening can detect breast cancer at an early stage. Some hospitals also offer ultrasound examinations. In fact, more cases of early-stage breast cancer are found through breast cancer screening than through the initial symptoms I mentioned at the beginning, so I strongly encourage you to consider getting screened for breast cancer. How can you get breast cancer screening in your area? In some regions, there are subsidies available, so please check with your local government or municipality for more information. Check your local government's website for this information. Some may have received breast cancer screening details, but tossed them by mistake. Isn't that true for some? Let's review lesson 3. As a way to reduce the mortality rate from breast cancer, I introduced breast cancer screening. In Japan, once you turn 40, you can have a breast cancer screening once a year, which includes a medical interview and a mammogram. This is called organized cancer screening and is recommended by the government. By doing this, you can definitely reduce your risk. Since this is one of the few cancer screenings that can do that, please consider taking it. Now then, everyone, I know you've been waiting for this. We've talked about the symptoms and the tests. I'm sure you're wondering how you can actually reduce your risk of breast cancer in your daily life. This time, based on the data, I'll introduce 5 things that may help lower your risk of breast cancer. I'll be introducing lifestyle habits. Here are 5 lifestyle habits that can help lower your risk of breast cancer. The first one is to reduce your alcohol consumption. There is a highly reliable study called a meta-analysis, which summarizes 110 clinical studies, and it shows that even a small amount of alcohol consumption is related to an increased risk of breast cancer in women. The data has been published. According to a large-scale study comparing alcohol consumption and the risk of breast cancer, when comparing people who don't drink alcohol with those who drink 3 to 6 drinks per week, it was said that those who drink have, on average, a 15% higher risk of breast cancer. And it is said that the more alcohol you drink, the higher your risk of breast cancer becomes. There is data showing that consuming 10 grams of pure alcohol per day, which is about 1 500 ml bottle of beer a day, shows that people who do that have a 10% higher risk of breast cancer. So for people who drink 2 bottles, the risk goes up by 20%, and for those who drink 3 bottles, it's said to go up by 30%. So even reducing your alcohol intake a little might help lower your risk of breast cancer. That's what the data shows, but it's important to note that the data only shows that people who drink alcohol have a higher risk of breast cancer. It doesn't show that reducing alcohol will definitely lower your risk. So can we say for sure that cutting back will reduce your risk of breast cancer? We can't say that for certain, but what is clear is that drinking alcohol is a risk. If you want to lower your risk even a little, you might want to consider reducing your alcohol intake or even quitting drinking altogether, lowering the risk of breast cancer. Here is the second of the 5 recommended lifestyle habits. The Mediterranean diet. Are you familiar with the Mediterranean diet? It includes things like nuts, vegetables, and olive oil. And it's a diet that focuses on eating foods found along the Mediterranean coast, especially fish. This kind of diet is also suggested to potentially reduce the risk of breast cancer. In a study involving 4,000 people between the ages of 60 and 80, the study included extra virgin olive oil and mixed nuts. There is data showing that people who followed a Mediterranean diet had a 68% lower risk of developing breast cancer. However, it's just a single piece of data. It's not clear whether those people underwent mammography screenings for breast cancer, so we can't say for sure that the Mediterranean diet reduces. There is a possibility, so it might be worth trying, but since there isn't solid data yet, I would like to share any new information as it becomes available. The third lifestyle habit to reduce the risk of breast cancer is exercise. By exercising, you can also lower your risk of cancer. I think that's surprising. In a highly reliable study that summarized 139 research papers, about 230,000 people with breast cancer and those without breast cancer were included. They compared 4 million people without breast cancer. As a result, those with higher physical activity had a 22% lower risk compared to those with lower activity. There is data showing that the risk of breast cancer is reduced, and this exercise is suggested to lower the risk for both premenopausal and postmenopausal women. As for the intensity of exercise, it is recommended to aim for about 7 METs. If you're wondering what 7 MEs means, METs are a unit of measurement for exercise, and 1 MET is the amount of energy you use when you're sitting quietly in a chair. 7 times that would be, for example, light jogging, swimming, skiing, or skating, activities that make you a little out of breath. Exercise at about this level is considered 7 METs. This kind of exercise is beneficial for high blood pressure, diabetes, and lipid disorders. It's said to be important from a preventive standpoint, so it may also help lower the risk of breast cancer. Once a week is fine, even starting with 30 minutes. Please try to be conscious about getting a little bit of exercise. Here's the 4th of the 5 lifestyle habits to lower the risk of breast cancer. It's a diet that reduces fat and includes plenty of vegetables. There is a very famous study supporting this. In this study, 49,000 people were divided into 2 groups, those who ate a regular diet and those who ate a low-fat diet, and they were followed over time. That sounds pretty tough. After tracking them for 8.5 years, the group that was recommended a low-fat diet lost weight. Even after more people also lost weight, when they checked again 20 years later, it was reported that the people who worked hard to reduce fat in their diet had a 21% lower incidence of breast cancer. It's not simply that the risk of breast cancer decreased because they lost weight and reduced fat. Even after adjusting for the effects of body weight, or even if you ignore it, eating a diet with reduced fat may have led to a decrease in breast cancer. That's what the research results suggest. Just by reducing fat, you can lower the risk by as much as 21%. If that's the case, I think this research is worth trying, while also referring to things like nuts and olive oil from the Mediterranean diet I mentioned earlier. Please give it a try. For example, you could replace the fatty parts of your meals with olive oil, or when you get a little hungry, instead of eating fried foods or chocolate, you could switch to nuts. Even just making changes like that you might be able to reduce your risk of breast cancer. The 5th and final lifestyle habit to reduce the risk of breast cancer is to lose weight. Gaining fat increases the risk of breast cancer. I talked about that in the second part. According to a study that followed 50,000 people for 24 years, who had never used hormone therapy and lost more than 10 kilograms. Women had a 57% lower risk of breast cancer compared to women who did not. What do you think? Isn't it surprising that just by losing 10 kilograms, the risk was reduced by 50%? Of course, if your original weight was already appropriate. If someone at a healthy weight loses 10 kilograms, it can be dangerous and even life-threatening. The point isn't to lose 10 kilograms at any cost, but to highlight that obesity is a risk factor and achieving a healthy weight is important. Such efforts may help reduce the risk of breast cancer. Now, let's review the lifestyle habits that can help lower your risk, to reduce your risk. As for lifestyle habits, the first one I mentioned was alcohol. If you drink one additional 500 milliliter bottle of beer per day, your risk increases by 10%. Second, the Mediterranean diet, which focuses on olive oil and nuts, as well as meals centered around fish and dairy products, can lower the risk of breast cancer. I mentioned that this is a possibility. The third point is exercise. I explained that people who do activities like jogging or swimming to the point where they get a little out of breath have a lower risk of breast cancer. And the fourth point, it's a diet that reduces fat. I explained that there is a difference in breast cancer risk between people who follow a low-fat diet and those who do not. And finally, it's about body weight. People who lost 10 kilograms had a 50% lower risk of breast cancer compared to those who didn't. That's what I explained. Now, let's do a final review. In the first part, I talked about 5 early symptoms of breast cancer that you'll regret not knowing: lumps, dimples, abnormal nipple discharge, irregular menstruation, and lumps under the armpit. That's what I introduced. And as a self-check, you should examine your breasts once a month. I recommended making that a habit. In the second part, I talked about the characteristics of people who are more likely to get breast cancer, such as being exposed to female hormones. I mentioned people with long exposure, those overweight, those with a family history of breast cancer, and people in their 40s and 50s. In the third part, I explained breast cancer often lacks early symptoms. So let's get cancer screenings to reduce the risk. Here's what I discussed. Thanks for watching the whole video. Let me know in the comments if you've heard similar things at the hospital or want to share your testing experience. If anyone has experience with breast cancer, I would really appreciate it if you could share your story in the comments. I would appreciate it if you could rate this video, whether it's a thumbs up or a thumbs down. It will help me with future videos, and if you found this video even a little bit helpful, subscribing to the channel would really motivate me, so I'd be happy if you could do that. Well then, see you in the next video.